In our health segment today, many people suffer from low thyroid, and the #1 cause might be something that you haven't heard of before. Dr. Josh Red is a nationally known doctor for his management of low thyroid, and he's here with one of his patients today. This is Krista. Thank you for being here. And we're going to talk about an underlying cause of low thyroid. What would that be?
Yep, the #1 cause of low thyroid is a disease called Hashimoto's, which is an autoimmune disease that attacks the thyroid. It destroys the thyroid tissue at a rapid pace, but also causes a lot of other problems elsewhere throughout the body.
So a lot of people may be being treated for thyroid that haven't even considered they might have Hashimoto's.
Absolutely. They go to the doctor will run what's called a TSH marker and put them on a thyroid hormone, but nothing's being done to the actual Hashimoto's, and that's why these patients will feel little to no improvement, because the autoimmune disease continues to flare up, destroy the tissue, and cause all the problems and symptoms and all that. Okay,
so Krista, before you saw Dr. Red, what were your symptoms like?
Just fatigue, feeling run down all the time, a lot of digestive problems, just headaches. You know, the list goes pretty long.
Well, and did you brush them off initially, saying, you know what, I'm just tired?
I've felt that way for so long, so much of my life, that it just felt normal to me.
So we're looking at some before pictures of you, and obviously busy mom, right? So you probably put off going to the doctor. Did you eventually go and you started to be treated for thyroid?
I actually, about 15, 16 years ago, had half my thyroid removed and have been on hormone replacement since then. But it's never been, I mean, it's been up and down, and my dosage has always changed, and I'll feel good for a while, and then things will start going downhill again, so I go back to the doctor and they adjust the medication, and then, you know, it just was such a circle, a vicious circle.
And you're frustrated?
Yes, I was very frustrated.
And then you went to see Dr. Red, and
I
what
did
he say?
He asked me questions, lots of detailed questions about symptoms, and he said that he was going to treat me with for Hashimoto's, and from there we just discussed what needed to be done and the tools to succeed.
And what kind of change did that make for you?
Oh, tremendous. I mean, everything that just felt wrong before just kind of slowly went away, and I never felt better in my life.
We saw the before and after pictures just a couple minutes ago. How much weight did you lose?
I've lost close to 70 since going to Dr. Red.
Lost 70 pounds. Does this happen for a lot of your patients?
Yeah, I mean, as far as this is concerned, this isn't like a weight loss program. We're not here to lose weight. Our goals are basically trying to increase their quality of life, because most of them have 0 to 5 good days of the month, and our goal is to increase their quality of life to where they have 20 to 25 good days of the month. They can function, they can be a mom again and be a wife again and do the things that they need to do.
But Hashimoto's affects your ability to lose weight,
Absolutely,
right?
Yes, it does. And so we can go in and figure out those different little imbalances and obviously help them lose weight. But this is, I mean, not all patients are going to lose 70 pounds. I mean, she worked really hard. She did the necessary things that we told her to do. I mean, she really worked hard. But our main goals are to increase their quality of life and then teach them and educate them so that after our program is done, they're empowered and they have control of their disease, so they can continue to do that for the rest of their life.
So for our viewers out there, how would they know if they have Hashimoto's?
Well, if you have any of these symptoms that we talked about today, you know, the depression, the fatigue, inability to lose weight, headaches, you know, anxiety, restlessness, and insomnia, those are some pretty common symptoms. So if you have any of those symptoms, you should come get checked out.
And consistently, right? Not just here and there.
Yeah, consistently. Yeah, definitely.
And ask the right questions and go to the right doctor, because, I mean, you spent a lot of years saying what's wrong.
And that's the great thing about going to Dr. Red, is he has this questionnaire and he talks to you about specific things, and things that you thought are just normal, that he's going to say, no, that's not normal. We can fix that.
Well, and as women, we brush off so many things and say, I think it's normal, because you're
dealing
dealing
with that.
Yeah, with everything else in your life. Okay, you look happy. Are you now?
I am. It's been great, because I've never felt this good in my life. I've always been overweight, and that's just what I've been used to. And so to have this kind of change is just.
And Dr. Red, that must be gratifying for you.
It's awesome. We literally see this every day in our office, and it's the most rewarding job in the world without any question. So
if this is something you have questions about, or maybe you know somebody that you'd like to ask questions for them, RedRiver is the place to go for information. It's the Health and Wellness Center there in South Jordan. All the information right there on your screen. You can also go to lowthyroid101.com for more info, and we'll link you from our site at abc4.com. Thank you for being here.
Thanks for having us.
Thank you.